Thank you for the invitation. Thanks, Vincent, for the introduction. I just got back from vacation, and I just realized we don't still got the translation of our new Center of Excellence correct. We're still juggling with it. So Center for Excellence, I wrote that in patient and public partnership, but I think it's going to be a Center of Excellence for partnership with patients and the public. Is that right, Vincent?
That's perfectly right.
Yeah, it was just announced last week, so we're still juggling with the translation. So thank you for the invitation. I don't have any conflict of interest. The only thing I may disclose is my first time at the Hemophilia World Congress, so it's a great opportunity to be here and learn from what I see as a very rich and vibrant patient community and research community. So it's quite exciting to be here and learn from your experience. So I think Vincent actually used that same slide and cover page from the BMJ this morning. So it's quite a cool picture. It was in 2013 that BMJ dedicated an issue on patient engagement, and it said, "Let the patient revolution begin." And they said in the editorial that patients can improve healthcare, and it's time to take partnership seriously. So this issue really resonated with what has been happening in the past 2 decades. So greater calls for public and patient engagement in research and health system transformation. So in one hand, we want to make sure that research that is being conducted is really responsive to the needs of patients and caregivers and the population. But we also want that the organizations working in the system, the policymakers that are making the decisions for the health systems, are really guided by the knowledge, the expertise, the wisdom of the patients and the public. So let's give you a couple of spoilers right away in case Vincent cut my presentation short. Here are the 3 key messages from my presentation, and I'll further develop these in the next slides. So the field of patient and public engagement has really been marked by incredible and several innovations in the past 2 decades, and I'll give a few examples in a moment with a specific focus on some of the initiatives being done in Canada and in Montreal with the Center of Excellence. Yet what we see is that facilitating or triggering this patient revolution is quite challenging. Not everybody is jumping in a bandwagon. Not everybody is convinced about the value of patient and public involvement. So we need to build the evidence base to showcase the value of patient and public engagement, to show that it really makes a difference. It has a real impact on research and system transformation. So that's why, and in my concluding remark, I'll try to have a discussion with you as how can we build an international evaluation coalition to build the evidence based on patient and public engagement. So many people in this room may be engaged in different activities, in patient and public engagement activities. Picori and Latifa are engaged in these types of activities. How can we bring all that together to create the evidence base that will showcase the value of public and patient engagement and sustain this revolution underway? So if you want to leave right now, I don't recommend it because Latifa is right after that, but you already have my 3 key messages for the presentation. So here's a list of what I found as really innovative efforts in the past 2 decades. I'm just 38, so for the past 20 years I've looked at this field of public and patient engagement, and it has really evolved, and we've seen new mechanisms, new types of approach to communicate with patients and the public, to consult with patients and the public, to participate and even to partner, and that's a key word today, partnering, to have patients and members of the public as co-researchers, as co-decision makers on advisory boards and committees. And not to mention all the new web platforms that are currently being used to engage with patients and the public. So that's a lot of great innovations. We've also seen the emergence of a professional community in terms of public and patient engagement. They are currently developing ethical guidelines on how we should do this work. try to identify what are the core competencies. If you want to train people in engagement activities, what are the core competencies that they need? We even have dedicated forums to discuss these issues. We have dedicated journals like Health Expectation, and just recently this new open access journal called Research Involvement and Engagement. And even now, if you want to publish in BMJ, you need to describe how you engage patients in your research. So that's a requirement now from BMJ. We've all seen the emergence of patient-led organization and networks, and Vincent has been a champion in this area, trying to develop at the University of Montreal, and more specifically in the Faculty of Medicine, a network of patient partners. Now we have about 300 patient partners who are trained, engaged in the health system in Quebec, and also engage in defining the curriculum of in different faculties at the University of Montreal. So quite an amazing development. We also have increased support to build capacity in engagement. In the UK, we have this organization called Involve, which is dedicated to support patients and researchers who want to get into engagement activities. We have PICORI, as we have seen earlier, that also have this infrastructure to support researchers and patients. In Europe, we also have patient academies to train patients in Health Economics 101 and so on. So we want to train an army of patients who can, get engaged and be comfortable when they're sitting around a table with a bunch of epidemiologists or biostatisticians or clinicians, so they can speak their voice firmly and affirmatively. And one last thing that I've seen in the past 2 decades is really a greater openness in domains that have been traditionally been the protected turf of experts, like research, like health technology assessment. More and more you see publication in these areas where they actually talk about the benefits of patient and public engagement. But if we look more specifically in Montreal, just last week, it was officially announced the creation of this Center of Excellence for partnership with patients and the public. And the idea beyond the creation of that Center of Excellence was to bring together all the people that have been doing some fragmented work. We have all these cool experts doing work at the University of Montreal, but we need some infrastructure, a way to coordinate all these efforts. So we created the Center of Excellence that will bring together a partnership network, which is under the leadership of Vincent, Vincent's team, a network of clinicians, patients, policymakers, people interested to pursue patient and public engagement. We also have a partnership schools that will provide training opportunities to support partnership activities. And we have the group that I've been involved with so far, the Partnership Lab with Antoine Boivin, which is more focused on evaluating public and patient engagement initiatives. So trying to develop the science of public and patient engagement and partnership. And what's really interesting about this Center of Excellence, it's I don't know if we can say that in English, a bicephal organization, because it's led by both a patient and a clinician. So we have Vincent and Antoine. So it's quite unique that we have both perspectives leading the same organization. So it's quite an amazing accomplishment, I believe. And some of the work that we've been supporting in the past couple of months, just to give you a sense of the activities that we've been doing, we tried to set up some patient-powered research networks. In Canada, about 2 years ago, they launched the Strategy for Patient-Oriented Research. So essentially, they said that, we're going to fund your research, but you need to engage patients, and it needs to be focused on patient-oriented outcomes. So a lot of researchers have found this new passion for patient engagement, and they came to us to, try to support their activities and see how they can develop a patient and public engagement strategy and how they can operate a research network which is patient-powered. And what I mean by patient-powered research network is a network that is operated and governed by patients, by advocacy organizations, by researchers and other partners. And it draws on the experiences and the expertise of patients and caregivers to direct a patient-centered research agenda, which is with patient-oriented outcomes. And in the United States, you may be familiar with these types of networks. PCORI has been actively engaged in nurturing the creation of patient-powered research networks. One example that we have of a patient-powered research network is the Canadian National Network of Transplantation Research. It's a network dedicated to increase organ and tissue donation in Canada, also dedicated to improve the survival and quality of life of transplant recipients in Canada. And with the help of Vincent, they developed this patient engagement strategy and completely transformed the structure of their network to really have patients as co-researchers, as actively engaged as partners in the governance of the network as well. So the idea behind that was really to develop a strategy that will instill a culture of partnership between patients, healthcare providers, and policymakers in the area of transplantation. Another type of activities that we've been engaged in the past 2 months was in organizing public deliberations and public dialogues on various issues, and one of them was quite a sensitive issue. We organized a series of dialogues on medical aid in dying. In Canada, we just recently adopted a series of legislations legalizing medical aid in dying. It was, of course, led by numerous and controversial debates on this issue, but there was not much dialogue between people on this issue. So they had enacted these legislations, and we realized that, well, even healthcare providers, patients, and the public didn't really know what the full legislation was about. What are the eligibility criteria? What's the actual practice of medical aid in dying? So we hosted face-to-face and online public dialogues, bringing together all the stakeholders engaged in this area, ranging from healthcare providers, physicians, inhalotherapists, nurses, patients, caregivers, members of the general public, to discuss what are your information needs on this issue, and also how can we create through partnership between all these different actors when a patient asks for a medical aid in dying when they're at the end of life. So, and it kind of resonated with me, this idea of doing these public dialogues this morning when Alain Ville talked about some of the issues that the hemophilia community is facing, a lot of social, cultural challenges that the community is facing. And it resonated that we probably need public dialogues to address some of these issues with the general public, with researchers, with experts, with patients, of course, and families. So these are the types of activities that we've been engaged in the past couple of months. But what we could say is that we still face a lot of challenges. And one of the challenges is that the revolution that we're trying to do is cultural, it's political, and it's scientific. So it's not just a political revolution that we're trying to do. It's cultural, political, scientific. It's extremely challenging. And a lot of people are still not convinced about the value of patient and public engagement. A lot of unanswered questions still. For instance, what are the impacts of patient and public engagement in research and health system transformation? What are the ingredients to make it work in a sustainable way? What work in different contexts? So, for instance, if we put in place a mechanism in a developed country, does it work in a middle, lower income country as well, or vice versa? So these are the type of unanswered questions that we have right now, and kind of remind me of a policymaker in the UK that I interviewed a couple of years ago for my PhD, and I asked him about the impact of public and patient engagement, and the person said, well, do you mean the warm and fuzzy feeling? And it's exactly that. So we need to go beyond the warm and fuzzy feeling of engagement and really look at what's the actual impact that it can have on research and health system transformation. And currently, the evidence base for this is still weak. We have an old Cochrane systematic review back in 2006, so it's an old review that indicated that there's a huge gap in the evidence from comparative studies about desirable and adverse effects of patient involvement in healthcare. But we have more recent reviews that also indicate that research dedicated to identifying the best methods to achieve engagement is still lacking and clearly needed. So there's really a gap in this area that we need to fill together. So evaluating public engagement, time for an international coalition. And what we're trying to do at the Partnership Lab within the Center of Excellence is trying to develop this evaluation infrastructure with robust theoretical foundation, strong evaluation method, innovative research practice partnership, and we hope to achieve and capitalize on national and international engagement initiatives. There's a ton of natural laboratories doing initiatives in engagement. I know that PCORI is actually doing some incredible work in this area, and they actually have an evaluation program to evaluate their partnership activities. So they have at the network level a series of questionnaire. I believe it's Net and Act. Is that We Enact? And at the research project level, it's Net and Act. So they have two questionnaires. Am I right? Yes, I'm right. Two questionnaires to actually evaluate the potential impact that their initiative may have from the researcher perspective and the patient perspective. So we need to build on these type of initiatives to learn about these type of activities. A project that is currently on the way in Canada is the Patient and Public Engagement Evaluation Toolkit. So we're currently trying to do a systematic review to identify all the evaluation tools that have been published and unpublished on the issue of public and patient engagement. So we try to identify all the tools available that we can learn from, and we're going to create a toolkit that people can use afterwards if they're interested in evaluating their engagement activities. So this is a project that's funded by the Canadian support units across the country in Canada. So as a conclusion, I think there's really an opportunity to leverage the energy, the skills, and the expertise in this room and in this community to create an international evaluation coalition. So if you have a moment afterwards and if you have ideas of how we can build that international coalition, please come forward. It would be, I would be extremely happy to discuss with you. And I think that building this evidence base will be necessary if we want to really showcase the value of engaging patients and the public, and also ensuring the sustainability of this revolution. So thank you very much. If you have any question, we have a website for the Partnership Lab right now. We'll soon have one for the Center of Excellence. So please come and check us and have a discussion with us afterwards. Thank you.